それでは時間になりましたので始めさせていただければと思います。本日はアバディーン大学で模索する公衆衛生の新たな姿体験講義ということでウェビナーを実施させていただきます。今日は画面に映っているハンレイ先生から大学について教えていただきたいと思います。よろしくお願いいたします。ハンレイ先生はPhD を日本で取得されて、後も長い間日本にお住まいになられておりましたので、もしわからないことがあれば日本語でも質問いただけたらと思いますのでよろしくお願いいたします。ハンレイ先生よろしくお願いいたします。
よろしくお願いします。アバディン大学のシャロン・ハンリーと申します。よろしくお願いいたします。で、これから英語でお話しさせてください。So I'm going to start with a little bit about myself. So I did my undergraduate degree at the University of St. Andrews. It was in modern languages. And then I did my PhD at the University of Hokkaido in the Department of Public Health. And because I did all my PhD in Japanese, so I understand about studying in a foreign language, how it's difficult, how it takes more time. But I found studying in a foreign language very positive too, very beneficial, and also I made many friends. And my specialty is cervical cancer prevention. So I worked in Japan a long time. I worked at Asahikawa Ika Daigaku. I worked at Hokkaido Irio Daigaku. I worked at Hokkaido Niseki Kango Daigaku. And then I worked for a long time at Hokkaido Daigaku. Then I came back to Scotland in 2023. And I've been working in Japan, in Aberdeen, at the University of Aberdeen for 2 years. So most of my adult life I actually spent in Japan and not in the UK. So the current position, I'm a senior lecturer in public health, and I'm also the program lead for the January start for the MPH program. And as you can see, my speciality is cervical cancer prevention. So I look at HPV vaccination and also cervical screening. And for research, I recently got a £1.3 million grant from Cancer Research UK to look at HPV self-sampling to help increase screening. And also I have a joint bilateral grant with the University of Nagasaki from the Royal Society of Edinburgh, and it's looking at WHO behavioural and social determinants of HPV vaccine. And I'm making a Japanese version of their questionnaire. So that's a little bit about myself. So a little bit about Aberdeen. So Aberdeen, the University of Aberdeen, is Scotland's third oldest university, and it's also the fifth oldest in the UK. So in Japan, you have like Tokyo University, Kyoto University, Hokkaido University, etc., that are the imperial universities. The University of Aberdeen is what we call an ancient university, and it was founded in 1495, so it's very old. It's got a long history. And Hokudai has a very lovely campus, but so does the University of Aberdeen's Old Aberdeen campus. We have two campuses, one in Forester Hill, where all the science and medical, well, lots of the medical stuff takes place. And then we've got Old Aberdeen as well, which is the former, that's where the university started. And the campus in Old Aberdeen, that's been listed as one of the UK's top 10 most beautiful historic campuses. Where I am in Forester Hill, that is the largest clinical campus in Europe. So we've got a maternity hospital, we've got a children's hospital, and we've got a big university hospital as well. So we've got 3 hospitals, and then we've got the medical school. And that is where the MPH classes also take place. We've got a lovely new library. That's down in Old Aberdeen, and that was named one of the most beautiful libraries in the world in 2016. And it's very cold at the moment in Aberdeen, it's snowing, so the library is a lovely warm place where you can go and study. And we've got a very big sports village it has Olympic-size swimming pool. It's got an aquatic centre. Lots of our students are very competitive and do very well at sports. So really good sports facilities as well. And this is our 2020 aim. This is what we want to do. So Aberdeen is open to all. So it wants everyone to come and study regardless of your nationality, your gender, your race. It's open to everyone. So we're inclusive, we're interdisciplinary, we're international, and we're sustainable. We look at the global sustainability goals, SDGs. So how about for public health? So the University of Aberdeen is #1 in Scotland for public health research, and it was also in 2025 voted #1 for medicine in the UK in the Guardian University Guide. So the Master of Public Health. We have 3 different types of programs. We've got the on-campus program that has a January start, which I lead, and it has a September start, which Dr. Catherine Martin leads. She's off at the moment, but she will be back soon. And then we've got an online MPH program led by Dr. Janet Kyle. And I think maybe for Japanese students, potentially the online course too may be very attractive. So the program aims, what do we aim to do? So the program aims to provide students with the knowledge and skills necessary to address public health challenges and improve the health and the health equity of populations, communities, and particular groups within them. So for example, in my research, which is about increasing cervical cancer screening, I particularly look at women who live in rural and remote areas, so not in urban areas, because Scotland has many rural and remote areas, as does Hokkaido, and also disadvantaged women. And we emphasize using and developing, so we put emphasis on the use, the development, and the critical evaluation of conceptual models, evidence, and methods of analysis, and on effective interventions at policy for local, national, and international level. My Cancer Research UK grant will inform the Scottish Government's national screening programme about how to best implement HPV self-sampling. So the programme structure. So for the on-campus, if you start in September, this is for students who would like to specialise in a research-focused career, potentially through a PhD or research-focused jobs. So they will have in the summer a research project. That's worth 60 credits. If you start in January, this is for students who would like to specialise in a more practical-based job, such as working in the community or policy development. So you'll have a work project with some local public health organisation. It could be NHS Grampian, Public Health Scotland. We will match you to some organisation that can meet your interests. Also, our curriculum is validated by the Agency for Public Health Education Accreditation. So having a validated MPH course is very important. I think in Japan, maybe only Osaka University, Kyoto, Todai, and maybe I can't remember the other one. I think there's maybe 4 universities that have accreditation. So we're an accredited university for the curriculum. So let's look at the structure. So in January, for the on-campus MPH and even for online, you've got 4 core courses, and these are in orange. These are the courses that you must pass if you want to get the MPH. So we've got Public Health in Action, Health Economics, Applied Statistics, and Epidemiology. And apart from them, you have to take these 4 courses, and then you've got different electives that you have to take. The January course is divided into 3 areas. You've got the first stage 1, stage 2, you've got your work-based placement, then 1 other course, and then stage 3, you've got 1 course and 2 electives. And then for the September start, you do your research project in the summer. You can take a regular research project that's 60 credits or an advanced research project that is 90 projects. And again, you need to pass the bits in orange if you want to get the MPH. However, if you fail one of these courses, you can then take a different elective and move to the Masters of Applied Health Sciences, and you can still graduate. It just won't be with an MPH, it will be with Applied Health Sciences. So next, the online. So the online MPH is 180 credits. It's very flexible, so you can progress at your own pace. It takes a minimum of 24 months, but you can take longer. But we recommend that students take no more than 30 credits per term, and you can take breaks between courses. If you don't have the right background, if you maybe don't have an undergraduate degree, you can also start with a short course, 15 credits, and then, or you can say, maybe I don't know if I really want to commit to a full master's, so you can start doing that, and then you can maybe decide if you want to commit. So when students miss the deadline for applying for a full degree, you can also do a short course, and it's also if you don't meet the formal degree entry requirements. And the very good thing about the public health online is you never, for example, if you're doing London School of Hygiene and Tropical Medicine, you have to go to Tokyo to do the exam. Here, you can do all the exams online. You don't need to go to Tokyo. And here are some employment examples. So we've got someone who's many people work in the NHS, some people work in policy, and some people, for example, one person was a program lead at Healthcare Excellence in Canada. So there's many different routes to go after you graduate. So what is public health? I'm just going to talk a little bit about what is public health. So it's a state, so health is a state, according to the WHO, of complete physical, mental, and social well-being, rather than just a mere absence of disease or of infirmity. But public health is different. So health looks at the individual person. Public health targets the population as a whole. So according to the Faculty of Public Health in the UK, public health is the art and science of promoting and protecting health and well-being, preventing ill health and prolonging life through the organised efforts of society. So it's a population-based intervention, not an individual intervention. So for example, if somebody was in a car accident, with clinical medicine, you go to the hospital, you maybe have an x-ray, you might have to have surgery, you may need to have the cast, that's gips in Japanese, on your leg. For public health, we would look at why that might happen. If they had a car accident, were they too tired because they're working too much? Was the road bad? Was there pollution? So there are maybe other reasons. So the public health looks outside just the individual reason for something happening. And public health has got lots of different names. You can be community health, population health, health education, health promotion, health improvement, public health medicine, community medicine, social medicine. So it's got lots of different names, but they all do the same thing. So they collect and they use epidemiological data. So that could be data on births, data on the cause of death, data on smoking rates, etc. We do population surveillance, so that might include COVID-19 surveillance dashboards. I was in Japan during COVID. I was in Hokkaido, and we always had the dashboard of the number of cases, number of hospitalizations, number of clusters, number of deaths. it might be a vaccine registry, it might be water quality surveillance. It also involves recognition of the wider determinants, so the social determinants of health. That could be education, access and quality, healthcare access, economic stability. If you have a job or don't have a job, how does that affect your health? And then developing effective solutions to public health problems. So vaccine programs, screening programs, tobacco control measures, clean water systems, seat belts in cars, etc. So these, for example, in Japan has a lot or a high suicide rate. So it could be in the subway, you can have the barriers so that people can't jump onto the track before the train arrives. And here are some examples of public health practice. So tackling climate change, disease surveillance, health service planning, program evaluation, reducing the incidence of drug-related deaths, quality assurance of population-based vaccination and screening programs, communicable disease outbreak and management, and then, for example, improving health outcomes and experiences for children and young people. In Japan, you have a low birth rate, so there's lots of public health practices to try and increase the birth rate by making the workplace more woman-friendly, or by having creches for couples to take their children. Where I used to work in Hokkaido University, they had a 24-hour creche for doctors who were on call. And then in the media, this is just an example. I just looked today, just recently, public health is always in the media. So you can be talking about vaccine, flu, screening, brushing your teeth, how to deal with mental health. So lots of different areas of public health. And if we were, for example, in our course going to give you an assignment, some homework, an example might be, because we have students from all over the world. I had a lovely student from Nara Ika Daigaku last year. She came and did the on-campus course. So a typical assignment might be, in a country of your choice, outline one key public health achievement. It could be like measles eradication, stopping smoking, increasing childhood vaccination coverage, preventing domestic violence, and then write short notes to describe why it was important and what difference it made to the population's health. So that's a type of assignments. We have something called My Aberdeen, where you go online, you can look at the lectures. All the lectures have subtitles, so you can see the written words as well as the spoken words. There's a video of the lectures, and there's lots of notice boards, that blackboards we call them, where you can have discussions with your tutor or with the other students. So I'm now going to just give a case example, and this is the area of my research, and it's about the HPV vaccine crisis in Japan and how a public health policy actually failed. So let me just begin. So what was the public health problem? So Japan is a high-income country, but despite being a high-income country, the incidence of cervical cancer is high. So if you look at the diagram here, compared to other high-income countries in the region, like Korea or Australia, it's almost double the incidence. And even it's higher than many lower or middle income countries, like it's higher than Bangladesh, higher than China, higher than Cambodia, higher than Vietnam. So that is a big problem. And also another problem is screening coverage in Japan is low. So screening coverage is about 40 to 43%, whereas the WHO recommends it should be between 70 and 80%. So What does that mean? Well, if you look at where the cases are occurring, the cervical cancer cases in Japan, it's women of reproductive age. That means women who are having babies. So if you get cervical cancer, most of the time you have to take away your uterus, so you cannot have a baby. So it's important to try and prevent cervical cancer because it affects the next generation as well. And why is this important too? Well, it's not just about not having babies. The effects of cervical cancer can have last a lifetime. So if you have to have surgery, you take away some of the lymph nodes, and that means potentially that you have some bladder dysfunction, you have bowel dysfunction, you may not know when you need to go to the toilet, you can have lymphedema, which is swollen legs, you'll have infertility. And if we think, like, if you get cervical cancer when you're 30, and the life expectancy of a Japanese woman is 84.36 years, you're going to live with all these systems for a large part, maybe 50 years. There's a financial burden, so there's the cost of the surgery, cost of treatment, cost of aftercare, the temporary or permanent inability to work. And then there's the mental health burden. You could worry about bladder control. It might be difficult getting married because in Japan, having children is much more important, I would say, than in the UK or in Europe. You might feel self-conscious about wearing your uniform for work because your legs might be swollen. You might feel self-conscious about going to a hot spring. So these are things that last the whole lifetime. So it's very important that we try and prevent women from getting cervical cancer. And so what is a possible solution? Well, one possible solution was the HPV vaccine. So the HPV vaccine protects against 90% of cervical cancers and many other oral and anogenital cancers in men and women. So mostly it's given to girls and sometimes boys around the age of 12 years. The UK has a gender neutral program, so both boys and girls get the vaccine. I believe in Japan it's still only the girls. And they get it before sexual debut, because the virus that causes cervical cancer is a sexually transmitted virus. So it's better to give them it young before they're even thinking about having sex. The vaccine is highly safe and it's highly effective. And the WHO recommends that 90% of girls get vaccinated against HPV by the age of 15. So what happened in Japan? So in Japan, there was temporary funding in 2010. The temporary funding was for girls aged 12 to 16 years. And at that time, they used what is called the bivalent vaccine and the quadrivalent vaccine. So the bivalent vaccine protected against two types, the most common types that cause cervical cancer, and then the quadrivalent vaccine, HPV4, added another two types that protected against genital warts. And initially, there was really, really good coverage. It was about 80%. The vaccine was then included in the National Immunization Programme in April 2013, but then a victim support group was formed maybe 1 or 2 months previous to that. There's lots of unconfirmed reports of adverse events in the media, so it's a media storm. If you look at this, the pink and red and green, these are pink are positive, green is neutral, and then blue is a negative. So suddenly, after the vaccine was introduced into the National Immunization Programme, the media coverage went from being really positive to really negative. And because of this, based on no good epidemiological data, it was just on, unconfirmed reports in the media, then the government suspended proactively recommending the vaccine. So it was still free for girls 12 to 16, but if a mum came and brought a girl or a dad came, we had to say the government wasn't proactively recommending it. And what happened then, so this is data from Sapporo, is you can see the coverage was really, really good. And then after the government stopped recommending it, so this was the year the girls were born. So for girls born after the year 2000, so they would be about 25 now, then coverage just was really, really low. It just went from about 80% to 0 overnight. And why did this happen? Well, there's really, really poor risk communication. So Japanese government made this leaflet, the pink leaflet that all parents had to have if they brought the child to say, to get the child vaccinated. It says we're at the moment not proactively recommending the vaccine, but it was still free. You could have it if you're between 12 and 16. So there's confusion between it's free, you can have it, but we're not actively recommending it. They ask the parents to consider the risks versus the benefits before having the child vaccinated, but there was no epidemiological evidence to show that the risks outweighed the benefits. And then since it was a new vaccine, the government said there was no evidence to show it prevented cervical cancer. That is what the anti-vaccine people used to say. But actually, it was because the girls got the vaccine at age 12, and it takes about 10 or 15 years for cervical cancer to occur from HPV infection. So you had to wait 10 to 15 years until you saw the effects of the vaccine. So it wasn't that it didn't work, it was just we had to wait to be able to show that it worked. So the risk communication was poor. This was a leaflet for the caregivers. You can see that this girl's got this big bump on her arm. It was talking about the side effects again, and it was saying that the government wasn't actively recommending the vaccine. Let's compare that to the UK. So you can see very positive messaging from the UK government, telling the children that they're going to get it at school, saying that it could prevent over 100,000 cancers, not saying that it hasn't been shown to prevent cancer, but in the future, it could prevent over 100,000 cancers. So it's very positive public health messaging from the UK compared to the messaging from Japan. Also, the Japanese public health experts were silent and the non-experts were vocal. So this was one online seminar. The people against the vaccine in Japan use social media all the time. The moderator was a jazz pianist. The speakers were a diplomat, a mayor, a president of one of the victim support groups. None of these people had any expertise in public health. If that had been the UK or Australia, then a public health individual from the Government of Health would have stepped in, would have made some comments in the newspaper, on the news. The Japanese public health experts were sadly silent. But those against the vaccine, the non-experts, were very vocal. And here you can just see some of the messaging that was done in Ireland or in the UK. It's very positive from the WHO too, about saying why we get the vaccine, how the vaccine can protect you. It has lasting benefits, it's safe. So you can just see how public health, communication and messaging can just have a big impact on then what the population does, what the target population does, how it reacts. And what were the consequences of this? So I did some modelling work. I did this with Australia. We got together and we used some mathematical models to just try and quantify the impact of the coverage going from 70% to 0%. So we estimated that there would be 26,000 additional cases and over 5,000 additional deaths in the girls born between 1994 and 2007 if the coverage stayed at 0%. So compared to if it had stayed at 70% and not gone down to 0, you had all these additional deaths, and these deaths could have been prevented very, very easily. And it could have been prevented with quick action from the government. Like if the government had acted quickly and they had a catch-up program, around 80% of these cases could have been prevented. But the government didn't do anything. And unfortunately, then the messaging from Japan, because of social media, just spread around the world. There was some issues in Denmark and Ireland and Kenya and the Philippines. So the public health consequences in Japan became global public health consequences. However, it's not all bad. So in Scotland, for example, we had high coverage. So in Scotland, coverage was about 90%. And now, since we've been using the vaccine for over 15 years, we found in a study published last year that there was no cervical cancer cases detected in vaccinated women. For the women who had been vaccinated when they were 12, to date, there's no cervical cancer cases. So it just shows the difference between if you have high level and low level coverage. So possible solutions might be, a possible solution might be gender neutral vaccination. So vaccinating boys and vaccinating girls. Maybe a 1-dose schedule. Japan still does a 2-dose schedule, but many other countries do 1-dose schedules. UK does 1 dose, Australia does 1 dose. Better risk communication, better understanding of the social and behavioural determinants of vaccination. That is what I'm doing with the Royal Society of Edinburgh. And also introducing HPV self-sampling. I also did that in Japan. I did that in Ebetsu-shi in Hokkaido. It's called Jikosaishu in Japanese. So we distributed some HPV self-sampling kits to try and increase the cervical screening rates. So I've given you an introduction to public health and one case study about what I'm doing in Japan. So I want to thank you for listening, and I want to finish with this quote. And the quote is, "Healthcare is vital to all of us some of the time, but public health is vital to us all of the time." And we could see that during COVID. During COVID, the virus affected everybody, and how other people acted affected how you act, and how the government, for example, the Japanese government was quite late to introduce the COVID vaccines. Many countries started vaccinating quicker, so there might have been more cases. So public health affects everybody. And I'm just going to stop there and then take some questions. Do we have any questions? Oh, Kyoko, it's lovely to hear you from Hokkaido. How many students are there in the January course and this yes, so there are around, so we don't have the January numbers at the moment. In September, it was 56. It was 56 students. I shall put it in the chat. 56 students for the September. And we're waiting on the numbers. We think the same. Think the same for January. And yes, students can receive, yes, students receive direct guidance from the course coordinator or from me, the program coordinator. Are there any other questions? 日本語でも大丈夫です。Over 90% of students are from overseas and don't have English as their first language. And we also have a language center that offers language support. So for example, in Japan, I would say you do lots of maruanki, like just memorizing things. Whereas in the UK, you might have to write some essay. So the language center will help you understand how to write the essay. So there's lots of different support. And most of our exams are not in a classroom. You can have some assignment that you might have to do the PowerPoint presentation or write some case study. So it's not the paper exam in a classroom, but you have time to prepare. So that also helps you if English isn't your first language. You're welcome. So I'll give you my email address if you have more questions. Sorry. So this is my email address. And if you had more questions, then you can email me in Japanese or in English. 日本語でも英語でも結構です。どういたしまして。Are there any other questions? Do we have someone called A-san? Maybe, I don't know. Not sure who that is in chat. Kelly, might you want to come in and talk about the tuition or some things about admission?
Hi, everybody. Yes, I can speak a little bit about scholarships. So we do have the Aberdeen Global Scholarship, which allows for international students coming to study with us on campus to have, so this is for January and for September. So we do have a reduction in fees, and I will put the link in. We do have various other scholarships as well that you can search. So they're specific to each country, but the Aberdeen Global Scholarship is for international students coming to study with us on campus, and that allows a discount. So that is in British pounds, £8,000 discount. So if you were coming to study the Master of Public Health, that means that the fees for that would be 15,000 as opposed to 23,000. So it's a really good reduction for international students coming to study the MPH in January or September 2026. There are other scholarships available. So what I will do is I will just put a link in the chat, and that will allow you to search for various scholarships and see what's available if that's something that you would be interested in.
I'm not sure if JSPS might also have something. I'm not quite sure. The Japan Society for the Promotion of Science, they used to have some things, but I don't know what the current situation is for a master's student. I know they had stuff for PhD. I don't know about masters, but I would also recommend looking at the JSPS website. How about Are there any other questions about study in Japan? Agent, do you have any questions that you might want to know?
Thank you for the presentation. ありがとうございました。
Do you have any questions?
いや、そうと、他の大学と比較して、その公衆衛生で、アバディーン大学で学べることですとか、もしあれば教えていただきます。
はい。そう、多分一番有名のは、ハーバード大学とジョン・ホプキンスとロンドン・スクール・オブ・ハイジーン・トロピカル・メディシンで、この3つの大学は、ハーバードとジョン・ホプキンスは、あっちに行ってオンラインがなく、そう、アメリカの授業料も高いし、多分生活費も高いので、今ちょっとアメリカの政府も、留学生に対してあまり多分積極的受け入れはしていませんと思います。London School of Hygiene and Tropical Medicine なら、オンラインコースはありますが、発表の中にも話したように、試験の時に東京に行って、ブリティッシュカウンシルに行って、試験抜けなければないので、私も北大に行った時に、ロンドンスクールの MPH をしようと思ってたんですけど、多分、3つの試験があったとしても、私、北海札幌から東京までの料費が高く、今度、連日ではなく、3回も往復しなければないし、ホテルの泊まりもしなければないし、アバディなら試験は全部オンラインで行きますので、そのお金は少ないです。
ありがとうございます。
あと話したように、教室での、試験ではなく、課題みたいなもので、パワーポイントの発表とかレポートですので、英語が母国語ではなくても、実習を使っていろいろもう準備できますので。
ありがとうございます。
遠慮なく、どんな質問でも大丈夫です。
アバディーン大学の学習環境ですとかは結構日本人の方にも馴染むような生活が
はい、
ますか？
そうですね。アバディンはそんなに大きい町ではないので、あと MPH は、フォレスターヒルというキャンパスですけれども、無料のシャトルバスもありますので、市内の学生さんの寮とか、図書館とか、スポーツ会館とかは、15分か20分ごとに無料バス、シャトルバスもありますので、それ無料で往復もできますし、そう、 留学生の会館もあるし、その寮、普通の寮もありますので、あと他の町とエジンバラとかグラスゴーと比べて家賃が安いですね、アバディーン。東京、北海道、札幌と比べても多分安いです。
あ、そうなんです。過ごしやすそうですね。
あと、自然も多いですよね。そのアバディーンの周りに自然が多く、週末なら友達とハイキングもできるし、エジンバラは列車で2時間半ぐらいですので、そんなに遠くはないです。グラスゴーも。あと、アバディーンも空港ありますので、空港からもあちこちに飛ぶことできます。
ありがとうございます。フィールドワークとかで別の国に旅行といいますか、スタディトリップしたりですとか、別の国ではなくても現場を見てみるみたいな機会ってあったりするんですか？
あります。その work-based placement なら、その現場を見ることができます。それ January start だけです。でも他の、例えば Public Health in Action だと、実際に NHS、スコットランドの National Health Service、実際の病院とか、公衆衛生で働いてる、医師も講義にしますので、だから現場の方も講義するし、アカデミックの方も講義します。
ありがとうございます。チャットに、
Yeah.
河原さんから。
Yes, you can. We have a behavior change elective course. Yes, you can. And health inequality is for all courses. That's a big aspect of public health. So all courses cover, most courses cover health inequality. Yeah. And you can choose, if you're a September start, you can do your project on some aspect of behavioral change. So the behavioral change course is led by health psychologists. In the university at the Institute of Applied Health Sciences, we have a health psychology master's as well. So the health psychologists will lead the behavioral change course. We have many different experts from different disciplines.
ありがとうございます。その他にも質問がもしあれば、この後もメールですとかでご連絡をいただけたらなと思います。はい。出願に関しては、そうです。スタディインに関してについてもご返信いただくような形でご連絡いただけたらと思います。では最後にそうですね。何か追加でお伝えされたいことなどありますか、ハンレ先生。
ぜひアバディーンに、来てください。もう大歓迎しますので。
はい。ありがとうございます。シェリーさん、do you have anything from your side? So we will finish the presentation.
No, it was lovely meeting you all, and we hope to see you in Aberdeen at some point. So thank you very much for your time today.
Thank you. はい、ありがとうございます。それでは本日はこちらで終了とさせていただけたらと思います。